Great. So welcome back. This is our second episode of a sort of casual conversation about the COVID-19, otherwise known as SARS-CoV-2. For those of you who have not seen this before, my name is Adam Hershberger. I am a faculty member in the biology department at Albright College. And with me is Dr. Josh Williamson. Josh,
Thanks, Adam. I'm the college physician here at Albright, and just looking forward to another good conversation. I enjoyed our last conversation about this topic.
great. So Josh, if you could you start us off with a little check-in on the progress of the number of cases and how we're doing in Pennsylvania and also worldwide?
Sure. Adam and I are part of the pandemic task force here at Albright, and so this is always my job early on in those meetings to talk about the numbers. So obviously these numbers are changing rapidly, and globally we're at 3 million cases. Unfortunately, in the United States, we're approaching 1 million. Here in Pennsylvania, we're at 45,000 cases. And in Berks County, we have 2,500 cases. So the good news is that our daily increase of cases has actually been coming down. We've had some blips in the road here over the past week, but here in Pennsylvania, our numbers, we've had the lowest daily increase report yesterday than what we've seen in well over a month. So hopefully we're moving in the right direction with this.
So to use the language from the news, right, is that flattening the curve?
It's funny because a lot of the curves look flat, and I don't know if that's particularly due to our efforts or if that's, it seems to be that a lot of places see more of a plateau than sharp peak or multiple peaks over a period of time, and it kind of looks more like a plateau than a peak. But hopefully what we're doing is flattening the curve, and we certainly, knock on wood, we haven't overwhelmed our healthcare system, at least not here in Berks County.
Sure.
So hopefully we're past the point where we're still at risk for that, but only time will tell.
And if you look at the current news from like the last couple of days, I mean, coming out of various states, including our own, they are discussing a phased reopening beginning as soon as this Friday, I believe, in Pennsylvania. Is that correct?
I think so. The starting with a lot of outdoor activities. I actually have some homework to do on that because we have a new subgroup out of our committee to look at what Albright's going to do. And so I'll probably have a better answer for you at our next discussion.
But yeah, I think some parks and various outdoor settings are going to start to phase reopen, construction limited, things like that. So I believe schools, though, are closed through this school year, and I doubt that'll change.
Yeah, definitely in Pennsylvania. And then part of Governor Wolf's reopening plan is once we move further into the phase of reopening, is to still limit numbers as far as how many people are congregating in a group. And I think 25 is what I read in his plan is kind of going to be the next phase. So even once we're able to do things, there's still going to be limits on how many people are recommended to be in the same area.
Right. And this is my opinion. I guess I should say this is not the official, stance of Albright College or anything. But I mean, I think at least for the short term, we should at least discuss possibly having like a mandatory face mask for shopping, various activities. Because I know, like, I was reading in Germany, they are trying to reopen things, and for example, like on their subway system and mass transit. There is a mandatory requirement that you can't ride mass transit without having a mask on. And I think steps like that are a good idea to help limit spread and exposure while still try to having some semblance of a reopening of both our lives and the economy. Did you want to do you have any thoughts on sort of like just briefly on things like a face mask or something like that with respect to our, how we go about our lives at the moment?
Yeah, we talked about our time limits today, and my thoughts on face masks might exceed that pretty drastically. Um, because now, as everybody is getting used to, I'm sure, face masks aren't comfortable. And as one of the big things early on was wash your hands, don't touch your face. But now I haven't been out in public a whole lot, to be honest with you. But the few times that I've been around people, you see them touch their mask, touch their mask, touch their mask. It's
Hmm.
really probably the worst thing that we could have happening with that. There's a lot of interesting new, but also very small studies looking at certain things with masks. So unfortunately, this is one of those things where even though masks have been around for a really long time, on our Albright email, we got a pretty cool email yesterday with some of the old posters from the flu pandemic
Hmm.
100 years ago, and the discussion of masks at that time. And here we are 100 years later still having this discussion without good science to back it up. There was an interesting small study looking at um, does um, people that were known to be infected, when they cough, what goes through certain materials, and where can you identify the virus? And they actually found for these 4 patients um, organisms on the outside of the mask, but not the inside of the mask. So the theory there is that you generate enough force to expel the particles either through or around, and then you get a turbulent flow that deposits it back on the front of the mask, which is a little bit of a scary thought, right? Because
Yeah.
then you're messing with your mask because you're sweating underneath of it, or it's uncomfortable, or it came off your ear, or whatever, and now you're touching the very area that you've just deposited, and now you're touching something else.
And it also, I guess, provides a false sense of security potentially as well, right?
Yeah, that's definitely another big concern. So
And this is just my opinion, right? To me, is it something almost akin to, well, it's better than nothing? Like, do you think that has any merit to it or not?
I think that we feel like we need to do something. So whenever whenever you feel like something's wrong, you feel like it's better to do something than to do nothing. And so it's not just good enough for us to be washing our hands or using hand sanitizer, which you can't get your hands on anyway. um, and so now I'm gonna wear this mask, and that's gonna be a good thing. Um, in a lot of the Asian countries where they've been gearing up and getting ready for avian flu, that's something that they do routinely now. There's been some smaller studies that, and I haven't located them to really go through the actual science, but I've heard reports about you know some some benefits shown in some of those areas. So there's going to be tons of information about COVID-19 when this is all as this progresses and when it's all done. So it'll be interesting to see. Hopefully, somebody's doing some good prospective studies about mask use, and hopefully, we get some good information about how useful that was, not only in the United States but in our big cities. Compared
Mhm.
to rural areas and all that other stuff.
And I think the other piece is in some of those Asian countries, it's more part of their culture, a little more accepted to wear a mask, and maybe they're more used to it. And maybe, and I once again have no evidence to back this up, maybe they wear it more appropriately because it's more ingrained in their culture and they're used to it.
I would agree with that
So
100% because as you get used to it, you don't have to mess with it so
right.
much. You're more cognizant
So it's certainly not
of
something that we're used to here, and I think a lot of people are resistant to wearing them. But if worn appropriately, and I think I've seen a few, like I said, there's some small scale studies coming out, but I think some research on flu. So you kind of have to extrapolate to coronavirus, but from flu, I've seen a few studies show that it can reduce transmission, not so much for which is interesting, not so much acquisition, because, I mean, unless it's like an N95 where it's literally restricting flow around the mask, something like a surgical mask, I mean, air can get in, but I think there is some evidence for flu that it does reduce transmission. But interestingly, in those studies, how they set it up, not as much on acquisition. I don't know why that is, but I've seen a couple small scale studies on flu with respect to that.
Yeah, you're definitely right, and that's why surgeons wear those masks. It's not to protect the surgeon from getting sick; it's to protect the surgeon from transmitting something into the patient. So you're right; it's not unless you're wearing a respirator or an N95 to protect yourself. You're really doing it for everybody else.
Right. And so, really, I think, I mean, you kind of hit on this, but try not to touch your face and, like a mucous membrane, right? Your mouth, your eyes. Try to wash your hands. And I think the other piece is the social distancing piece. So even if you have a mask on, you still have to try to do the social distancing. And so I think if we can try to do that as a society, we can help reduce the chance of, say, a second wave or whatever term people are using. I do think that this is here to stay. I think this is clearly a human virus. It probably can go into animals, and maybe there'll be an animal reservoir. We can discuss that later. But clearly, it's a human virus. It's transmitting very well human to human, and it would not shock me at all if we hear about this again next winter/springtime. Hopefully at that point we'll have either therapeutic and or some herd immunity get built up that hopefully, or the hope is that the second wave, whenever that comes, would be not quite so disruptive. Did you have any comments on that, Josh?
Yeah, so that's we're hearing about that a lot, and the concern that that it could become seasonal. So Adam, you really think that we talked about this a little bit before we got started, but it's a successful virus because it makes people sick, but a lot of people, it doesn't make them sick enough to really limit their mobility, or even a lot of times let them even know that they have it or that they're carrying it. And so you think it'll just kind of keep ping-ponging around, bouncing around?
I do, yeah. I mean, I haven't seen anything to suggest that is not going to be the case, that it'll just completely disappear and never come back. I think it's more likely, in my view, that it will come back and hopefully at some point become more of a mild common cold like seasonal type of situation, but that's not going to happen overnight. So I think we still need research on a vaccine, drug therapy, all the above to deal with that, because this, the evolution of something to a very, very mild common cold like thing, it's not going to happen in one season, probably. So, but luckily the virus itself, unless you have a comorbidity like diabetes, unless you're elderly, it is still, I would say, once again, my opinion, relatively mild in most people. And so from the virus's perspective, I don't think there's any reason to think that it'll evolve to become more virulent or more pathogenic. So hopefully I'm right.
Yeah. What do you think about the news this week? Is that I guess in Chile they're giving cards to say that you had the disease, you're immune now. Mm-hmm. So you get your immunity passport or your certificate that you're immune. And I really thought that was going to be a big part of this too, is that, once enough people are exposed to it, and we talked about that a little bit last time, right? That maybe that's why kids aren't getting it, because they've already been exposed to a lot of coronaviruses. Maybe they have some cross immunity, and maybe that's what's going on with this one. But now I'm reading that a lot of experts are concerned, and they're feeling like just because you get it doesn't mean you are immune. What do you think about that?
Yeah, no, that's a good question. I mean, there has been some news recently come out. I think there's a small study in South Korea. There's been a few cases here in the United States of people testing positive. And just as a brief aside, before we get into that, so just hit the pause button real quick on that. Can you just take us through, like in a minute, what is the current, like you hear about the testing and the swabbing? Can you just take us through that briefly?
Yeah, definitely. So, well, there's a couple different options. It made the news a while ago when our president got swabbed. He had that nasal pharyngeal swab. So
Hmm.
they literally take a Q-tip. Well, it's a special Q-tip,
Yeah.
but it goes into the nasal passages all the way back to the back of the throat. It's very uncomfortable. You're supposed to put the swab back there, rotate it. It should be in there for a few seconds. Take it out, do the other nose, and then you can even do the throat. Um, there's some places have moved to just doing the throat. It's much more comfortable for the patient. And now there's some saliva tests as well. So these are all PCR tests. So they're trying to identify um, RNA from the virus itself, and then you have your diagnosis. You know that it was there,
Right.
or at least there's evidence that the virus is in your system.
Right. Yeah, yeah, yeah. Thank you. And just to add to that, I did see it came out just yesterday on bioarchive. There was a small study from a group from, I think, concentrated in Yale. There's another one from Rutgers, I believe, a week or two ago. They have had some success developing a test based on saliva, which would be huge, because if you could just say like spit in a tube, that would be obviously more ideal than having to do the swabbing, where people say they feel like they're getting their brain swabbed, you know. um,
Definitely.
and
And,
so and so
and the other, just to finish that up, that thought up, Adam, is that then you have the serum test to look for antibodies against the virus, and
yeah,
that
so
would
you know what I think
that
we'll do.
typically shows that you're immune. At
Right,
least
exactly.
there's a cutoff that we think that shows immunity.
Right. So I think what we'll do is we will, I think for our third episode later this week, let's start with that. Let's have a discussion on kind of the testing and also the immune system side of things.
Okay.
But right, so right, to get back to the other point, this whole like immunity card thing, right? So there are some small studies suggesting that somebody that tested negative, or excuse me, tested positive, then negative, and now retesting positive again. I mean, there's a couple scenarios. I mean, one of them being, well, what if the test when it was negative was actually not negative? For it could be various reasons. It could be the molecular side of things. It could be an error in the test itself, in the tech that performed the test, or maybe the swab wasn't performed properly.
No test is 100%.
Yeah, exactly. No test 100%. So it's just as likely that the patient was actually still positive that entire time. Or if we assume the test is accurate, it's certainly possible the virus can kind of um, like within the body kind of have waves of what's called viremia, or your viral load kind of goes up and down. And at that moment in time when they were swabbed, they actually were negative. It is possible, but then maybe the virus is not cleared as quickly as, say, a rhinovirus, which causes a common cold, completely unrelated family. Those people are thought to actually clear it from their body. It's an acute infection and it's cleared in a relatively short period of time. But maybe this virus kind of hangs out longer, right? I mean, we're going to know that the more people study it, and we just don't know the answer yet. From the moment you get it to the moment that you test negative and remain negative, how long is that? And the other piece, just to kind of throw this in here, is when you do a PCR test, you're testing for a fragment of the genetic information of that virus. It doesn't actually mean, or it doesn't prove that there's actually replicating virus in you at that moment. It just means that there's a fragment of the genome. It doesn't mean that it's actually an intact, like replicating virus particle that is still there at that moment. And so the only way to know that, it's kind of akin to sending a swab for bacterial culture. Like in a way, like if you could swab, but then put it on some cells and see if there's replicating virus still there growing, that would also be something useful to know, because a PCR-based test doesn't tell you if there's actually live replicating virus at that moment in time. So basically, in a nutshell, it's very complicated.
Yeah, you said that so much better than I did, Adam, and that's why you're the professor.
Oh,
Yeah,
stop.
but one thing that happens with that, you know, I mentioned that PCR became available a long time ago clinically, but you know now we swab patients, we send this out for panels. So some companies offer big panels that they're, like you said, looking for fragments, and so we get results back, not just what we were looking for, but 3, 4, 5 things. Some of them that can cause very serious diseases like meningitis. And so you get these results back, and you say, "Oh my gosh,
Right.
this kid. If you look at this panel, this patient, you know, might be terribly, terribly sick, but there they are, home running around doing everything, and they're completely fine." But like you said, that could have been a fragment that's left over. You know, we carry a lot of stuff in our nasal passages, in our throats.
You'll never get sick, right? You'll never get sick. So
Yep.
yeah. So it's kind of like, it's almost like a tyranny of information, right? Like information overload. Like, what do you do with that information? Just as a quick aside, I mean, we talked about this in my genetics course a little bit. You know, people that do these genetic tests, and, you know, whether it's, you know, 23andMe or something else, I mean, you could go mad if you say, oh, I have this allele that I'm carrying, I'm a carrier. Like, oh, what does that mean? I mean, it might mean nothing. And yet, you know, there's that information, right? It's just information, but what do you do with it? But, you know, just in terms of, you know, just to kind of finish up that part of the question, I mean, if you just look at the history, you know, the natural history of viruses and humans, most of the time upon re-exposure, either you have no symptoms or more mild than the first time. And I don't see anything yet that makes me think that this won't be something similar to that. It would be surprising though if someone was negative and then got reinfected, right? Like a true reinfection. It would surprise me if the immune system was that, like if the response being made was that insufficient to prevent reinfection that quickly after having it. So I'm really, you know, just as someone who likes immunology and, you know, researches a little bit, teaches it, I'm really interested in that particular piece of this whole story. Is it a true reinfection? And if it is, why is the immune system not controlling it better? But I still believe, my gut tells me that if it is a true reinfection, that the symptomology would be more mild the second time around, because you are going to have antibodies, you are going to have other things, and we can discuss some of that the next episode. So,
Sounds good.
yeah. So do you have anything else that you want to add, or do you think that we should wrap this up for this time? Did you have anything else that you thought we
Well,
should?
I want to come back to one thing that you mentioned with viremia,
Okay.
because we do think that has a clinical implication as well. You know, a lot of times patients will come in and say, "Well, yeah, I felt fine, but then I really started to feel sick again, and my fever came back." And you know, you definitely see this wave type pattern for patients, and I was always trained that that's, you know, the clinical side the of the viremia pattern. Can you talk about that a little bit more?
So,
Because
so
what they were what I remember learning is that, like you mentioned last time, the virus gets into the cell, hijacks the machinery, and then busts open with new viral
right,
particles, and then those then infect other cells.
right.
So I always had that picture in my mind that okay, well, the machinery is all clicking, and then now now the viral particles bust out, and then you get this spike in the fever or worsening symptoms.
Right, because
But maybe
eventually the
that's
immune system is going to catch on, right? The eventually immune system is going to say, okay, you know, there's a virus here. Let's respond, and that's when we start having a lot of the signs and symptoms, which are more related to the immune system than they are to the virus itself.
it's like the cytokine storm that you mentioned last
Yeah,
time
right,
with COVID.
right. So yeah, I mean, it probably is not just a, you know, a nice flat decline most of the time, right? I mean, if you were to sample somebody every 6 hours for the entire infection course, probably for most, whether it's a bacterial infection or a viral infection, it's probably, I mean, the trend might be going down, but at any given moment, it might be a little more wavy, right? So, to me, that's where, we can talk about this next episode, where having a rapid antibody test will be key, because a PCR-based test is expensive. It's much more, you need a lot more expertise to operate the test, and it takes longer to get the results back. And if it's negative, once again, you're looking at that moment in time, and you still might be infectious, you might still have virus, but at that location, at that time, right, it came back negative. Whereas if you do a antibody test, it's much less air, in my opinion, right? You're taking like a little prick of blood, for example. That's very easy to do. And it's a lot less air on the sample collection side of things. And if you come back as having antibodies against the virus, you at least can say with certainty that you've been exposed to it. Now, you don't know if there's still virus in you at that moment, but you can at least say, I've been exposed and I developed an immune response to it. So all these tests have their pros and cons, right? I mean, you do an antibody test, you don't know if you have virus actually replicating in you at that moment, but you at least know if you've been exposed. If you just rely on the PCR only, a negative test might not really mean that you've never been exposed. So, and maybe we can discuss that episode 3. So yeah, Josh, this is great. Do you have anything else you wanted to add?
No, it was funny when you were talking about how the trend goes down, but you're up and down. That's exactly what we're seeing population-wise as well. So it all fits together.
Great. Well, thanks for joining me again. So once again, if you have any questions, and if you've made it this far in the little episode, you can email me at ahirschberger@albright.edu. You can find my email address on the biology department website, and hopefully it's linked on the COVID page as well. So thank you, Josh, for doing this again. We'll try to do another episode later this week, and we'll talk a little bit more about the immune response and about some of the testing that might come out. Okay.
Sounds good. Thanks, Adam.
Thank you.